One of the most common issues we encounter in my practice today is chronic narcotic use. And the reason it's such a difficult issue is because patients usually start taking pain medications because they're in pain. And usually it requires more and more pain medication to control that pain. And over time, it becomes more and more difficult to come off the pain medication. And there are several reasons why this occurs. You develop something called a tolerance, meaning over time it requires more medication to get the same effect. The second issue with narcotics, when you stop taking narcotics suddenly, there's a withdrawal. The body gets used to the medication being in your system. There's a third issue with narcotics in the fact that when you're on chronic narcotic analgesics for a long period of time, you develop a lower pain resistance, meaning the narcotic saturates your pain receptors, so your body makes more pain receptors to counteract this. You may start the whole process with, say, 1x pain receptors. All of a sudden, 3 years later, on chronic narcotic use, you may have 10x pain receptors. Now, if you stop taking your medication, or you have an insult to your body, such as a surgery, the pain can be almost impossible to tolerate. So when I talk to patients about coming off their pain medications, I try to explain to them that it's not like the movies. You can't just go stop taking your medication, feel sick for a week or two, and everything's hunky-dory. The real reality is it takes months to get off the pain medications. Most patients we can slowly wean down, but at some point the patient will have to go through a three to 6 month period where they just don't feel very good, and they just got to get their bodies used to not having the narcotics in their system. I think when patients have a better understanding about the hold narcotics have on their body's system as a whole, the better they can handle coming off the medications. Patients who come into an operation who are already on chronic narcotic analgesics, it's very important to have a game plan on how after the surgery we're going to handle weaning that patient off the pain medication, and also having a game plan going into the surgery, how we're going to handle that patient's pain immediately after surgery. That's where we try as surgeons to work with our pain management specialists to try to maximize that patient's outcome. And this is why chronic narcotic use makes patient surgery much more difficult to handle and lowers the success rate with surgery. Most patients that have a good game plan will have a good outcome in the long run.